Thank you, everybody, for sticking with us throughout the day. It's been a great session, and I know it's hard to do day-long Zooms, so we appreciate you. So we have Sam Rogers-Melnick. He currently serves as an integrative health research and data specialist with University Hospitals Connors Whole Health in Cleveland, Ohio, my hometown. Sam received his bachelor in music therapy from is that Duquesne University, master in public health, and is currently pursuing a PhD in clinical translational science from Case Western Reserve. As a music therapist at University Hospital Seidman Cancer Center, Sam developed several interventions directed at improving pain management outcomes in adults with sickle cell disease in both inpatient and outpatient settings. He developed a structured music therapy program for young adults with sickle cell disease aimed at improving self-efficacy, trust in the medical profession, and sickle cell disease knowledge and collaboration with the pediatric and adult sickle cell teams. Without further ado, I'll turn it over to you, Sam.
Thank you, Yvonne, for that wonderful introduction. My name is Sam Rogers-Melnick. My background is as a music therapist, and I thought we could start today with some music therapy. I want to walk you through an example of a session that I do with adults with sickle cell disease to give them an exercise that they can use to manage pain day-to-day, stress day-to-day, things like that. And so this is some music with some guided breathing along with it. And there's different ways of doing breathing exercises. Some of them get really technical. But the way I do this, and this could be helpful on a day like this in the middle of the semester with lots of things always going on in March, what I encourage people to do is if you take one hand and you can put it on your chest and then one hand above your belly button, what you want to do is imagine that there's a balloon behind your belly button. And when you take a breath in through your nose, you can imagine that balloon inflating behind your belly button and that lower hand rising. And then as you breathe out, that balloon deflating. And so right now, I'd like to invite you to find as comfortable a position as you can wherever you are, whether you're at home or you're in clinic. Get situated in a way that'll allow you to relax. And as this music starts here, I'd like you just to become aware of how you're breathing right now. You can notice where you're breathing from, whether your shoulders are rising and falling, whether your chest is rising and falling, or your belly is rising and falling. Notice how your hands move as you breathe. And as more as this music comes in, notice the rate of your breathing. Are you breathing rapid or slow? You breathing deep or more shallow? And as you slowly inhale, you can imagine that air flowing deep into your belly. Feel that belly fill with air, and then slowly let that breath out as you completely exhale. Notice what happens as that breath of fresh air enters your lungs. Notice what happens as you exhale. You can feel the temperature of each breath. Cool as you inhale and warm as you exhale. You can count your breaths as you breathe in and breathe out. And as this beat starts to slow down, it's a good reminder to all of us to slow down when we need to. You can notice your breath starting to become a little more smooth and slow. You can feel your belly and rib cage expand outward with each breath. And feel yourself become a little more relaxed with each exhale. You can allow your shoulders to become a little heavier with each exhale. And continue that breath. Slow. And as this music fades out, I want you to take a moment, just remember this feeling of slowing down. And one more. And slowly come back to this room, a little more relaxed and a little more refreshed. All right. So I'm curious in the chat, how was that for everyone this afternoon? Good reminder to slow down. All right. Fantastic. Good to hear it. Awesome. So now I'm going to pivot away for some music to a little bit of research. I guess the first thing I'll ask is, can everyone see these slides?
Yes.
Excellent. So I'll be presenting Melody of Healing, the magic of music therapy on the quality of life in adults with sickle cell disease. Everything I hope to get to today includes our BEATS program to address transition outcomes, music therapy for acute pain, some surveys that we did to understand more about how adults with sickle cell disease use music, then some of our research in chronic pain, and actually some new stuff, which was recently published about the real world effects of music therapy and massage therapy at university hospitals. And then I'll close with an advocacy piece that we've been using at UH. And so in the introduction, it was mentioned that I developed this BEATS program, which stands for Build, Educate, Advance, Transition, and Sickle Cell Disease. And the idea here was this is a collaboration with the adult sickle cell disease team and the pediatric sickle cell disease team to use the way that music can be engaging and help to remember lyrics to make an educational program to help young individuals with sickle cell disease learn about how the disease works, manage pill box, all the skills that you need as you transition to adult care. And it wasn't just songs. We had props that I built by hand here. We imagined that the body is like a city, and you have the city bus, and you have the city bus representing your red blood cells, and the little red cars representing reticulocytes, and the ambulances representing white blood cells. And we'd use that to demonstrate how hydroxyurea works and how sickling works and different things in the body. And then we'd augment that with a rap kind of like this. This is our Know Your Sickle Cell Disease rap, and individuals would fill in specific lab values. So it might sound something like this. 8.8 is my baseline hemoglobin, the part of my red cells that does the O2 loading. If it's lower than this, I might need a transfusion, but call my doctor first so there's no confusion. 9.8 is my WBC, white blood cell count, there to protect me from viruses, germs, and other invaders. When I have an infection, what cell count is greater? 7.8 is my usual reticulocyte count. That's my fresh mix of red blood cells coming fresh out of the bone. Retics become red cells when they're grown. 98%, that's my usual pulse ox. That's how much of the hemoglobin in my blood stocks. Oxygen, I breathe it in through my lungs. It's carried through my body by hemoglobin, son. And so everyone would get their own individual rap, which is a very helpful way of remembering some of these values and then communicating them when you're suddenly an adult and you have to do that with a healthcare provider. Another rap that we came up with to discuss all the different types of blood transfusions and all their interesting procedures that go along with it is this blood transfusions piece. And I'm actually going to play the recording because the guest artist did a much better job of singing the lyrics. So this is blood transfusions. So let me break it down so there's no confusion. For sickle cell, there's three main types of transfusion: simple, modified, partial, and full exchange. They do different things to help you maintain. When your red cells break open and your hemoglobin dwindles, sometimes we have to do a transfusion type simple to give you red blood cells that your body lost. We make sure we match the blood with the type and cross. To put the blood in, we hang it from an IV so it can go into your veins easily and help your red cells carry O2 with hemoglobin that's higher. But remember, this transfusion also gives you more iron.
It's the blood going through your veins when we transfuse. We can make a change to your red cells. Carrying hemoglobin is your life, and we want it to keep on growing. It's your life, and we want it to keep on growing.
Next, let's talk about the. So that was a good way, and we had other verses about full exchanges and modified partials and the importance of iron chelation therapy and all these different kinds of things. And so when we did this study, it was just a single group study with 30 participants. We saw significant improvements in sickle cell disease knowledge over the course of the study. We saw social support as these individuals were engaging in groups with each other and older and younger individuals with sickle cell disease. We actually saw improvement in adult clinic attendance over the course of the study, which was, I think, a contribution between music therapy and the patient navigator that had started. Overwhelmingly positive feedback. Patients were demonstrating a commitment to this intervention, wanting to come to their adult clinic appointment because they were also able to engage in these BEATS interventions. And this was feasible within the real world clinic setting. I embedded myself within the adult hematology clinic, and this is published here in the International Journal of Adolescent Medicine and Health. But moving on to something that I've been focusing a lot of research on is pain. And when we talk about pain in sickle cell disease, it is unlike pain in any other condition. I think we know this from personal experience and with working with this patient. So when I talk about sickle cell disease pain, I often present this image, which is created by a patient who I work with, and she created this image when she was working with our art therapist to describe what a sickle cell disease pain crisis feels like. And it feels like a shattered glass in the chest, kind of like acute chest syndrome, a punching bag and a razor blade in your abdomen, like your legs are on fire, like there's electricity shooting through your arms. Because often these individuals deal with vaso-occlusive pain and neuropathic pain and musculoskeletal pain and avascular necrosis pain all at the same time. And so as a music therapist, this is a challenge. I have music, which is powerful, but the pain that these individuals are dealing with is also very intense. And so I have to be very considered and very strategic about how I engage individuals in the musical process to best address their pain. And so our first study that we did here was actually a 3-arm randomized control trial. It was looked at the effects of a single 20-minute music therapy session, which I'll demonstrate, on pain intensity, pain relief, and mood among adults with sickle cell disease who were seen in our outpatient acute care clinic for a pain crisis. In this study, we recruited outpatients with sickle cell disease during their normal visits, and then we would wait for them to have a pain crisis and present to the acute care clinic, which made study logistics kind of interesting, but we were able to randomize 60 patients over the course of the study. And when they came to the acute care clinic, they were randomized to either receive 20 minutes of music therapy with me, or 20 minutes of listening to a playlist on Spotify without a music therapist, or a control intervention with no music. This occurred after 1 hour after the first dose of pain medications. We did a pre-test, intervention, and post-test, and we also conducted interviews to further explore patients' experience with the intervention. So the way this intervention worked, when we do music therapy, research, it's a challenge because you want to have the full creative process of music, but it's also a standardized intervention for a randomized control trial. So the way we had this balance was we created 5 20-minute pieces of music that all followed this U technique, meaning they started out kind of chill and slowly became like super chill over the course of the music and then came back up. And over top of that intervention, the patient and I would actually improvise on a keyboard. So I'm going to demonstrate what the gospel intervention would sound like in little snippets. So the music would sound like this. And the patient and I would have like a little musical conversation. So I might say something like, and with no wrong notes, the patient could talk back to me. Back and forth over 20 minutes. And we noticed over the course of the intervention, patients would get more creative. With no barrier to engaging in music. And we noticed that it was really this engagement, getting immersed in that music, that was really beneficial for these individuals. And so we found in this study, we did a logistic regression analysis, which what are the odds of this outcome versus that outcome? And when we compared music therapy to control, you saw you were 5 times more likely to have a reduction in pain intensity greater than 1.25 units. That was significant compared to control. We didn't see those same effects in the music listening group. We also saw improvements in pain relief, and you were 11.6 times more likely to have a clinically significant improvement in mood if you were in music therapy. We also saw improvements if you were in music listening, but not to the same degree. So quantitatively, we saw something is happening within the context of music therapy that doesn't quite happen with music listening. And we looked at the interviews, which I think is more important. In both groups, both music therapy and music listening, participants described like, music helps you to refocus. I hear this a lot. It took my mind off the pain. When music was here, pain was over there. And I get that because music sort of is this stimulus that can sort of override some of the pain signals in the brain. But if you were in music therapy, it was more than that. They were engaged, they enjoyed it, it was relaxing, they had agency, they had control over the music. And the music therapist improvising with them provided comfort beyond the music. We provided a calming environment in the midst of a very uncalming situation in the hospital, helped to provide comfort. We were described in positive terms. I like this quote here, the music helped me, it put me in a better mind state. Instead of thinking I'm in the hospital, I'm in pain, I'm in agony, it was more soothing. It was like, the pain was soothed a lot. I feel more hopeful and I'm more optimistic. So music does a lot more besides addressing pain intensity. It addresses all these different things that individuals are facing. And we got recommendations like longer interventions, allow for change in music preferences, more music therapists to be available when individuals presented for acute pain, and an app for home use. So even in this study, we're starting to think, how can we translate this to help individuals use these interventions every day? But before we got to that, I think it's important to understand how pain evolves over the course of sickle cell disease. And I like this figure from Wally Smith and Shear from 2010. If you imagine the x-axis is an individual getting older in years, and the y-axis is your pain intensity on a 0 to 10 scale. The red line are these crises that happen over and over again throughout your life, starting in childhood. And often kids, they'll have a crisis and they'll go to the hospital to receive treatment, and they'll have periods in between crises where they don't have as much pain. But starting in adolescence, young adulthood, suddenly there's more pain that's there all the time. It's arising from repeated vaso-occlusion that's leading to avascular necrosis and bone pain. It's altered your nerves in such a way that this green line, that neuropathic pain starts to emerge. And if this individual has such exposure to opioids, the opioids can actually make that pain worse and lead to hyperalgesia. So there's all these different types of pain that can co-occur in someone who is a young adult. Many of these different types of pain do not respond well to opioids. And so we're in the situation where we not only have to address someone's acute crisis pain, but give them strategies to manage the pain that they deal with every single day. And so we had this acute pain music intervention. We wanted to get to a chronic pain intervention that could also help improve individuals' quality of life. But before we got to that, I really wanted to understand, well, how do these individuals engage with music in the first place? If you looked at the music therapy research at that time, and asked the question, well, what kinds of music should I use to help with pain? It was slow orchestral music and new age and flutes and pianos, because a lot of the research that was done with people who do not look like the individuals with sickle cell disease that we work with. And so it was important not just for the population, but to put a statement out there for research that if you're doing research with this population, you need to understand the culture and the music of this population. So in this study, we surveyed 100 adults with sickle cell disease about how they use music for mood and for pain, and what kind of songs do they listen to, and what else do you do? Tell me everything that happens when you're listening to music to help with pain. And what we saw was, what we'd expect. They liked hip hop, they liked R&B and soul, they liked Christian and gospel, which makes sense for the demographics of the population. But it's also important to say, yeah, hip hop can be very helpful for pain. R&B and soul and stuff with a beat and 808 can be very soothing for this population. Songs are about 74 beats per minute. Common artists were Drake and Kendrick Lamar and Future. Even amounts of major and minor songs coming out when individuals were about 22 years old. And so I wanted to put this out there as the profile of the kinds of music. I don't believe there's a single right type of music that's right for everybody. That wouldn't make any sense. Everyone is an individual. But if you're a music therapist working with these individuals, it's important to be competent to be able to provide this music. We asked, when you listen to music, what else do you do? I lie down, I close my eyes, I take my pain medicine, I put on a heating pad, because it matters how you engage with that music. And so we saw this correlation between the number of strategies that you use along with music, whether it's prayer or breathing or hydration or singing or things like that. There was a correlation between that and how helpful you found that music for your pain on a 0 to 10 scale. That was rated about a 6 out of 10 on average in terms of how helpful that music was. And we asked them what else was going on. It distracts me from my pain. We've seen that before. It helps me refocus, so the pain is over there, but it also helps my mood, helps with relaxation, helps with my stress, helps me fall asleep. I hope I didn't put any of you to sleep with my opening relaxation today. Helps me feel encouraged, lessens my pain level. So all these different things are happening. It was important to capture this in the research. And so with that data, knowing what kind of music the intervention that would be available, knowing that it's important how individuals engage along with music, we then conducted this study, the effect of music therapy on quality of life in adults with sickle cell disease, also known as our musical study. This was published about a year ago. And so in the study, we recruited 24 adults with sickle cell disease who also had chronic pain. And we did a large battery of quality of life instruments, self-efficacy, the PROMIS 29, which asks about pain interference and sleep disturbance, anxiety, depression, the Ask Me scale, which are sickle cell disease specific quality of life measures. We asked about coping. And then individuals were randomized to either receive 6 sessions of music therapy or be in a waitlist control group where they did not receive an intervention. Before the intervention, we had them do 2 weeks of a sickle cell pain diary that was developed by the folks at Emory University, and individuals actually engaged with this so we could get a baseline sense of what is pain intensity like day to day, how is pain interfering with things. Then we did the intervention. Then after that, 2 more weeks of the pain diary, and then finally a post-test to look at effects, and we interviewed people in the music therapy group. And so the intervention here was a 6-part intervention. It started with an education. So individuals with me, we talk about their pain experience. I would really validate that because that's important if we're going to start providing intervention. What is music therapy going to do? What do you expect from therapy? We actually built this model of a human brain and the nerves coming up from the spinal cord so we could explain how different pain signals are activated by things happening in the body and how music therapy can help to alter those pain signals. And it had lights and all this cool stuff. And then the next 4 interventions were practical interventions. So the second one was the breathe. I gave you a sample of that at the start of this session. The patient would create a beat on the iPad. They could be whatever they want, whatever instruments that you want. I would pump it into my studio. We would record and experience a live breathe track in the moment. Then I would cut that track, send it to the patient so that they could have it on their phone, and I'd ask them to practice that for the next week. So we not only created interventions that were personalized to people's preferences and imagery and anything else that they wanted to hear, but it was also a practical exercise that they could use. Similarly, with the progressive muscle relaxation, where they gradually relax muscles in the body, an imagery intervention where we went to a place that they found safe and comforting, and we had the sounds of that place and what did it look like and what did it smell like. And then the fifth intervention was active music making, that intervention that we had in my prior study. We were improvising back and forth on a keyboard. And then the final session was a conclusion where we would make a plan for how to continue using these music interventions in the future as stressors and pain and things like that came up. And so we found in the study, it was a feasibility study, a small pilot, but we did find that it was feasible. 89% of the individuals we approached consented, only one person withdrew. All the measures were completed, and along with all the interviews, we had high pain diary completion rates, about 70% completed at baseline, 66% at follow-up. We had also high feasibility of the intervention itself. All music therapy participants completed the intervention, reported achieving their goals for therapy. All the interventions were accessible on their own devices. You didn't have to buy new equipment to engage in music therapy. The majority of participants reported using these interventions at least every other day, and the interviews revealed a high degree of usefulness and acceptability. When we looked at the quantitative outcomes, the numeric outcomes, even with a small study like this, we did see some benefit. So if you're in music therapy, your sickle cell self-efficacy went up as compared to waitlist control. And then we saw reductions in sleep disturbance and pain interference. Now, pain interference is an important outcome that's different than pain intensity. Pain intensity is like, right now, how intense is your pain? 0, none at all, 10 being the worst, which doesn't always speak to how multifaceted pain is in an adult with sickle cell disease. Pain interference is how much is pain interfering with your life day to day? How is it keeping you from going to work or playing with your kids or things like that? And the fact that we saw reductions in pain interference during this time, when we did this study between September and December in Cleveland, where it's cold and the weather's changing, it's like the worst time of year for someone with sickle cell disease. It speaks to the potential benefit of this intervention. We also saw improvements in social functioning impacts of people describing, because I have this exercise, I'm better able to fulfill the social roles and responsibilities that I have. And then when we looked at what patients were saying about their experience of the intervention, we saw this theme again. It takes my mind off my pain, puts me in a whole other dimension. Like for those couple of minutes when the music is there, I'll be in a whole other world away from my pain. Importantly, we saw patients describing improvements in their coping skills. I can handle the pain a little bit better than usual. Sometimes people don't know that they have other options besides pain medicine. So knowing that you would have a way to make it feel better without having to be all drowsy and sluggish and stuff with your pain meds would be like, okay, I can cope. And we saw patients describing actually needing less pain medication because they had this other strategy. And that's how I see music therapy in this context. It is a strategy, a tool that you can use to improve your confidence to manage things day to day, which is really important as individuals are getting into adulthood, where maybe in the course of their care, they were not provided additional skills that they can use to manage when they have pain. And so conclusion from this study, we think that music therapy is feasible for home use in adults with sickle cell disease and chronic pain. I think this is a useful framework for other chronic pain populations, whether it's cancer pain or fibromyalgia, because it provides a framework for how you can structure an intervention. And there's not a lot of music therapy research in chronic pain in general that actually addresses real world chronic pain outcomes. I'm doing a systematic review right now looking at, well, what interventions are helpful for pain interference and catastrophizing and health related quality of life for adolescents, young adults with chronic pain who have sickle cell disease or cancer. And there's not really much out there because a lot of times we've only focused on the intensity of someone's pain. So I think this provides a framework for future research, which we hope to replicate at other sites. We think that music therapy can assist adults with sickle cell disease in reducing pain interference, improving sleep, improving social functioning. But of course, more research is needed to determine its effectiveness in other hospitals besides Cleveland and with other music therapists. And we hope to have news on that soon. And of course, have a study where you're comparing to a more rigorous control group, like a health education group or something else that's not just a waitlist control. And so pivoting away from that, in my role now as this integrative health research and data specialist, my job is looking at the real world effectiveness. So now if we've done these studies and we have music therapy in the hospital, we have massage therapy and acupuncture in the hospital working with these patients, what is the real world effectiveness? And often we're using the electronic health record as the data source for this. And so we have two sort of sister studies that we've done recently, one in adults with music therapy and one in kids with massage therapy. And because we have such a focus on sickle cell disease at university hospitals, we actually compared outcomes between individuals with sickle cell disease and individuals who had other hematologic or oncologic conditions excluding sickle cell disease. And when we looked at adults with sickle cell disease who received music therapy, and so we've got 158 patients in the hematology oncology group, 112 patients in the sickle cell disease group. What's important to note here is that patients with sickle cell disease rate their pain intensity significantly higher than individuals who do not have sickle cell disease, their anxiety significantly higher. They had a greater reduction in anxiety from music therapy, and they also had a greater reduction in fatigue. Now, what I see here, and it's important to demonstrate, is I know other colleagues who are starting integrative oncology programs at children's hospitals and adult cancer centers, and that's really important. But sometimes the services, whether it's music therapy or massage, are funded for the kids with cancer or the adults with cancer, and not for the same individuals with sickle cell disease who are on the floor who have a higher symptom burden. So I'm using this research, and I hope you use this research to advocate to say, hey, the individuals with sickle cell disease on our unit are probably reporting higher symptoms and they benefit tremendously. So they should be included within integrative oncology services and music therapy services and massage therapy services and acupuncture. Interesting to see here that there was a greater reduction in fatigue in the sickle cell disease group. There's some data out of Memorial Sloan Kettering that suggests that more active types of music interventions are more beneficial for fatigue, and those were way more common in the sickle cell disease group, so that might explain these differential effects. When we look at massage therapy, we see a similar story, but even greater contrast. Pain intensity in the sickle cell disease group, 7.2 versus 4.2 in the kids who do not have sickle cell disease. The individuals who didn't have sickle cell disease had a greater reduction in pain, but both were a clinically significant and statistically significant reduction from baseline. Individuals, kids with sickle cell disease rated their stress higher and their anxiety higher. So also when important in the context of pediatric care, individuals with sickle cell disease are reporting higher symptom burden, but they're also reporting tremendous benefit as a result of this intervention. And what I'm particularly interested in this kind of research is which modalities work best. There may, and I, in various stages of my career, I've had the opportunity to collaborate in the inpatient environment with a massage therapist and an acupuncturist. And we would notice, well, this patient, they really respond well to acupuncture. That's the best thing for their pain intensity. But maybe this patient over here, their anxiety and the stress they're dealing with, that's better addressed through music therapy. So I think it's important to be strategic when you have these services in their hospital, is which type of modalities are going to work best in which patients, and how do you triage these services appropriately when sometimes you only have one music therapist, you only have one acupuncturist. And so we're hoping that this data shows the real world benefit, but can lead us to ask questions around, okay, well, how does it affect their symptoms throughout their hospital stay? How does it address opioid utilization or length of stay? And this will be the subject of my dissertation, which I hope to complete in the next 3 years. So stay tuned. But we have this data that has now been published. This was published in Pediatric Blood and Cancer a couple of months ago. And so I do want to end actually with another important piece of what I think music therapy can provide for the sickle cell disease community, which is advocacy and providing a voice for individuals with sickle cell disease. We know from our experience and the literature, the unequal burden, the perceived discrimination, the systemic racism in this community, how that contributes to poor experience and mistrust and a greater pain burden because of this. And I saw it in my own clinical practice. And patients would express to me all the time how they didn't feel like the doctors were listening to them, how there are these communication patterns that happen all the time that are unnecessary. Things like, well, your labs look okay, or all these red flag types of things, these communication barriers where it was clear that sometimes providers, healthcare professionals, just don't understand the experience of individuals with sickle cell disease. And I felt that music could be the messenger to help convey that information and start a conversation about what's a better way to communicate about these issues. What's the better way to make a pain plan? What's the better way to facilitate a positive relationship within the hospital? And so what I decided to do was to make a song story, which we called I Wish That You Could Feel the Way That I Feel. I think I've heard that from a lot of individuals with sickle cell disease. If you could just feel the severity of this pain, maybe you would get it. And so what we did is we interviewed about 6 individuals with sickle cell disease and asked them to tell us a 3-part story. Part 1 is, what is real life with sickle cell disease like? What is the pain like? How do you describe it in your own words? Because a numeric rating scale just doesn't quite cut it. Part 2 is like real world negative experiences with care. Like, don't hold back. Like, what actually happens in the emergency room, and what are communication patterns that you've seen that really negatively impacted you? And then part 3 was, what's good care look like? What does a good communication strategy look like? How can we do a better job as healthcare professionals? And so I want to give you a sample of this 3-part story, which I then pivoted into an intervention. So we used the story and we had discussions around this story with new nurse practitioners on the medical oncology unit, with new nurses, as a training, as an education, so we can improve the care for individuals with sickle cell disease. And so this is I Wish That You Could Feel the Way That I Feel. And it goes along with these art pieces that were created by individuals with sickle cell disease and medical students as an artistic rendering of what the patients were saying.
I wish that you could feel the way that I feel. Feel the way that I feel.
You might see me sitting up here and not crying and not falling out the bed, but that don't mean that my pain ain't a 10 on a scale from 1 to 10. Or I might be on the phone and the doctor might come in, ain't nothing wrong with you, how's you on the phone if you got in pain or anything, but that's just not the case. Like, just because I'm not crying or falling out the bed don't mean I'm not in so much pain. Just mean that I learned how to adjust to the pain and take my mind somewhere to try to get off the pain.
My face, it do tell my feelings a lot, but like when I'm in pain, it won't, because I don't like people to see when I'm in pain. So it won't show. I smile, I'll be smiling or talking about something. I just won't let my pain show, because I don't want people to feel sorry for me, like, oh, Tasha in pain, Tasha, she hurting, she need this, we gotta do this, we gotta do that.
I wish that you could feel the way that I feel the way that I feel. You can't feel the pain that you can't see. I'm asking you to just trust me. I wish that you could feel the way that I feel the way that I feel. Don't you know I got a history? Don't wanna be treated unfairly.
So this is part 2.
And I have to go to an emergency department. It's kind of stressful. I don't know what's on the other side. I don't know who's there. I don't know if it's going to be a long wait. I don't know how they're going to receive me. That just in itself is enough to make the pain start back up.
No, this pain is real. Even if you can't feel, I'm asking you to listen to me. I need you to see. I'm calling out to you, asking for what you can do. Said I need you to see it through, because what I'm saying is true. Said I need you to believe in what I see.
To have somebody who says, hear you, I want to help. And it was almost like a sense of like relief. And I remember feeling, I didn't even know that I felt that way until he said what he said. And I kind of like sunk into the bed, kind of relaxed a little bit. It was almost like it was weird. It wasn't until he said what he said. And I was like, oh, I feel safer. I feel like, they're gonna, work it out.
Okay, I'm at a place where they want me to be. They're gonna take care of me. I feel safe. I feel comfortable, and I feel comfortable with them. So I'm gonna open up to them and tell them what's really going on with me.
We are so much more than the cells in our veins, than the sickle cell pain. We are so much more than a number on a scale, than what our labs entail. Listen to our voice, we know what we feel. We come here to heal. We're speaking the truth. Put yourself in our shoes. Would it change what you do?
And I think that's a good place to end, is with the voice of the patient, because it's the voice of the patients who I've been working with that inspired me to do this work. And I think music has a way of providing that message in a powerful way. And I look forward to seeing what we can do with these kinds of music interventions. And I want to quickly, before questions, just acknowledge everybody that made this happen. I started doing this research as a PI when I was 24. Somebody thought that it was a good idea, and it doesn't happen alone. Individuals who I believe are also on this call, Coretta Generette, Nadine Matthey, Jane Little, anyone who provided the expertise that I didn't have as a PI, enabled data collection, research assistance. Research is a team effort, and I was honored to be part of that team. And so I will take your questions. I know there's quite a few in the chat, but thank you very much for having me today.
So Sam, that was fantastic. And I think you're right. It's a wonderful way to end. Most of the chat is just blown up with how amazing this is. And people want to know if the video is available. And
yeah, so feel free to send me an email. This is something we're working on right now. There's a lot of demand for what we've put together, and there's a little bit of red tape around that, but we're happy to provide what we can, with patient consent and things like that. But we do have some materials that we designed that are ready for dissemination. So feel free to send me an email, and we can work to figure those things out.
okay, so we will make what we can, what Sam can make available to you all, and we'll work it out. I just want you to know that one of the chat says, "I have tears. This work is nothing short of absolutely amazing." So I think, I'm speechless. So I think that's the way to end, Sam. Thank you so much for being you, and thank you for persevering in this work for years and years. And we know it doesn't happen overnight, and it takes perseverance. And you've been in this space and doing this and pushing. And I know it hasn't been easy. So thank you for continuing to do what you do.
Yeah. Well, thank you. It was only because I came to conferences and I met a lot of you, and a lot of you said, "This is a pretty good idea. I think we'll help you out. We'll collaborate with you. We'll be research collaborators and show us the best way to do things." And so I look forward to continuing to collaborate with all of you to advance this research.
And I don't want to leave. Did I miss any raised hands, Sharonda, before we?
I'm looking right now. I know we had some questions in the chat. If you wanted to get to some of those, but I
We
don't.
have so much blown up in the chat. I'm trying to get to.
So one of the
Literally,
questions-
Sam, it's like.
Right. I will put, and my contact information is on the webinar. It's a lot about being able to access some of these materials. We'd love to be able to share those with you.
That was one of the questions too. Great, thank you for answering that.
Yeah.
We do have a question in the chat as well. We have someone that unmuted, and that is Miss Pat Corley. She has a question.
Hi, Pat.
Hi, Sam. I saw you when you were that 24-year-old. When you first started out.
I had a different haircut back then.
You had a different haircut. You're still amazing, though. I am just so, I'd never seen music therapy used other than in psychiatry before. And so to use it in sickle cell, where there's so much disparity, is amazing. And I'm excited about it. I'm excited about what it has to offer to our individuals with sickle cell disease. But I also wanted to ask if there is any consideration for incorporating it. I know in the past we used to do whirlpool with people with sickle cell disease, and measuring whether you use it in the two of those together make a difference as well, and shorten painful episode time.
Yeah, I mean, I have not. I know of some patients who have done aquatics and found different things. I think that is the kind of research that we need to do. Often a lot of research is siloed. So we looked at, well, how does music therapy work? And then how does acupuncture work? And how does massage work? But in the real world, if you talk to people in child life where this is really happening, there's collaboration happening all the time. And sometimes you see synergistic effects. I saw synergistic effects when I was co-treating with acupuncture, because acupuncture is a very powerful intervention for adults with sickle cell disease and acute pain. We have some data that we're hoping to get published soon about that. And often they are the individuals who buy into these services more than anybody else at a healthcare institution. So I think it's a matter of collecting data in the right way. My director, we are the director of the BraveNet Practice-Based Research Network, where we're collaborating with real-world integrative health and medicine centers around the country to set up data infrastructure to collect data about these kinds of things. And that's the kind of data we need to answer those questions, are which modalities work best in and of themselves, which modalities should be tried first. If you just start developing musculoskeletal pain as a 16-year-old with sickle cell disease, are we better sending you to receive some meditation training or acupuncture or chiropractic? Who needs more intensive interventions? And we're setting up some of that data infrastructure at Rainbow right now to actually screen adolescents and young adults for chronic pain and then direct them to appropriate modalities.
That's fantastic. I was told that we had 10 questions on Wahoo. So let's see if we can get to, is there, now this is really a music, you can tell this is a music person. Is there a specific frequency of music that goes best with these breathing techniques?
I get that question a lot, and I honestly don't know. That's sort of like a different perspective on the practice. There's sort of like a sound healing perspective where it's like this frequency leads to this change in the body, and I am not well equipped to handle that. I have had some patients who have requested specific frequencies and we'll pump them in. I believe that music is such an individualized experience that it's about how you engage with the music that makes the difference, not necessarily this specific frequency or this specific song. So I'm not best equipped to handle that, but I know some people who swear by certain frequencies or certain kinds of music that really help them.
Great. So another one was, are you offering a postdoc opportunity in the future or other research opportunities? I think they want to give you more work.
Well, I should probably finish my doctorate first. And then, but we are looking to collaborate, certainly. There may be some opportunities for that in the near future. And it is exciting that the National Center for Complementary and Integrative Health at the NIH is really interested in pain and sickle cell disease and music interventions. So we are down to help collaborate on developing proposals where we can advance that kind of research, and we'll see what kind of trouble I get into after I finish my PhD. But I will be dedicated to this community moving forward. I can tell you that much.
Thank you. Is music therapy available to every warrior, or is it something covered by specific insurance companies?
That's a good question. So in the context of the hospitals, it's mostly covered by the building itself. So, Simon Cancer Center, Rainbow Babies and Children's, they see music therapy as a benefit to the patient. So it's funded on operational dollars or philanthropy. The good side of that is that it's free to the patient. The downside is that it's not really offered outside of the context of being engaged in that specific healthcare institution. There are a lot of private practice music therapists around the country who, have services and they work certain things out. Unfortunately, this is not a service that is well covered by insurance anywhere. We're hoping that the data we collect helps to change that, especially when we see these benefits in terms of pain interference. But most cancer centers, most children's hospitals do offer music therapy services. They might not be targeted specifically to the needs of individuals with sickle cell disease yet. But we're hoping that this data helps to change that. And I'm happy to speak to any music therapists at any healthcare institutions to perhaps provide them training on what they would need to know to best tailor their services.
Fantastic. Do you have virtual melodic healing events?
We do. So we've been doing a lot more things virtually. When COVID-19 hit, we went 100% virtual. So we were getting patients on the phone in the hospital. We were setting up Zoom sessions. We were transferring a lot of our things. That is the kind of research that we really need to advance. It gets tricky because I can certainly make a fully immersive music experience like I facilitated today. But I need to be careful about like, well, what if you live in a very rural part of Georgia where you don't have good Wi-Fi or you don't have a computer where you can access those things? Those are things we're hoping to figure out in future research. But these interventions certainly do work. There's a lot of research happening right now where music therapy is being virtually delivered, and we're looking at the efficacy of that. Fortunately, it is one of the better translatable services, right? You can't really translate massage therapy virtual. You can translate certain types of psychotherapy virtual, but there is something specific about music. In fact, I think in the future we're considering about like, well, maybe that first session is in person and we get to know each other. We make some music together. We make some beats together. We do education. But maybe the next sessions after that, after we've built that rapport and made that connection, maybe those can be done virtually, so we save you a trip to your hospital or something like that. Or we need to be cognizant about like, well, let's meet you where it's best for you. Maybe we're at the community center. Maybe we're at a different location that's on your bus route or close to your neighborhood, so you don't have to drive 2 hours to the comprehensive center.
Yeah. So someone wants to know if the slides will be available. And I'll just answer, we will have the recording available for future.
Yeah, and all my slides are published data, so you can use them. Absolutely.
Great. Okay, well, Lori, you want to take us out? Thank you so much, Sam. I appreciate you again and all the work you're doing.
Thank you.